to somebody that they knew or somebody that they knows somebody in Canada or Great Britain. And that's interesting, and I'm sure you can find things on the other side, but the point is that's not where we're going to end up.
Yeah.
We're going to end up reforming our insurance system to make it more fair, helping small businesses, helping people have more choice in the market, the free market. That's what this is all about. They're a minority, and we're going to find that out. There's going to be a vote on a single-payer health plan, and you're going to find out how many votes that's going to get. It's not going to be very many. There are a few people who would like to move in that direction. It's a free country, and people have different views. There are people on the far right that don't want to do anything for whatever reason. But most of us, Republican and Democrat alike, are in the middle. We want to preserve what works and fix what doesn't work. So the end result's not going to be socialized medicine. Clearly, if we don't do this right, I don't know that the public option is going to survive the final cut. But if it is, if you don't do it right, then certainly you could provide an uneven playing field for which the government would have an advantage and businesses would then have an incentive to drop employees and put them in the public plan, and you have the snowball rolling downhill if you don't do it right. Now, if you do it right and it has to compete on a level playing field, no taxpayer subsidy, has to be totally self-sustaining, meet all the same regulatory requirements that the private insurers have to meet, and has to have negotiated rates, the same as any other private insurer, not Medicare rates or government rates. If you do that, then you're probably not going to see it have the opportunity to evolve into something that no one would want that to happen. But look, that's a legitimate topic of discussion. That's the discussion that's happening all across America. What is the appropriate role for government in our healthcare system?
Zero. No role.
All right, well, I told you where I am, but the point is, it's a legitimate topic. I would suggest that what we've seen across the country is the American people have a level of unease about that issue. And that's why the public option may not be a part of the final bill, although that's yet to be determined. With regard to the insurance companies, look, there's a lot of